Together we achieve victory over heart failure.
Hello and welcome to our podcast. I'm Dr. Gaurav Tripathi. I'm a consultant cardiologist in Suez Hospital, Raipur, Chhattisgarh. And today we are delving in silent epidemic that India is combating, that is heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence to witness young adults seeking medical assistance for heart failure. Unlike the Western countries where heart failure is predominantly a disease of the elderly. So let's break down 5 essential insights into heart failure. Firstly, what does it mean when a doctor tells you that you have heart failure? When people get the diagnosis of heart failure, they think it's the end of their lives. The term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently as it should. The ejection fraction, or EF, measures how well your heart pumps blood. It is the amount of blood pumped out of your heart's lower chamber, that is ventricle, each time it contracts. While normal EF is around 50 to 70%, individuals with heart failure typically have an EF of 30% or lower. Secondly, why are so many Indians affected by heart failure? So, genetics play a significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, and smoking habits worsen the epidemic. Moving on, what are the signs and symptoms of heart failure? So, watch out for confusion, fatigue, heart palpitation, nausea, shortness of breath, and weakness. And there is also loss of appetite and vomiting in these patients. Those patients having diabetes, hypertension, and have a history of coronary artery disease should get screened for heart failure themselves via consulting a cardiologist. So, how can we protect ourselves from this disease? Our heart works incredibly hard to keep us alive. There are 5 golden rules we can follow to return the favor. Early detection of heart failure through regular blood test and echocardiogram, dietary adjustment to maintain heart health, incorporating daily exercises into your routine, practicing stress management technique, and quitting alcohol, tobacco, and smoking whenever they are applicable. So, and lastly, what comes next after heart failure diagnosis? Thankfully, medical science offers numerous treatment options, and it's possible to lead an enjoyable, meaningful, and productive life even with heart failure. Heart failure medications improve quality of life and longevity. Devices like bioventricular pacemaker, implantable cardioverter defibrillator, and heart valve repair or replacement. These are all available to improve your quality of life. And a last resort treatment option is heart transplantation. The lifetime risk for CHF, that is heart failure, is 1 in 5 for both men and women. Remember, awareness and proactive measures are key in combating this silent epidemic. Thank you.